One evening I had left hip numbness, and it over 20 minutes expanded from both hips and down my toes. As a good nurse, I took care of myself for about 12 hours, and in the morning my son said, "Mom, you really should go to the emergency room." And by that time I had excruciating pain and wasn't able to walk. So I went to the Billings Clinic ER, and Dr. Dennis O'Brien is the neurologist that was on call. He knew right away that he was suspicious of transverse myelitis, which is a neurological disorder that affects the spine, and people become paralyzed basically from the waist down. I spent about 6 hours in the MRI center having various tests to try to confirm that. I had hospitalization for about a week and then did rehabilitation. And through that, I was able to learn how to walk and relearn a lot of the things that you would need to do if you have a lot of pain and numbness in your legs. I was, as a nurse, wanting more answers and wanting to know if there was a cure to what I was experiencing. Dr. Doug Bell, who is a radiologist at Billings Clinic, was a colleague of mine. I was a nurse in radiology for a number of years. He had a good friend and colleague in the Mayo Clinic system, Dr. Brown, who was a renowned neurologist there. And so I was able to get connected with him. He, at Mayo Clinic, once I arrived, he set me up with a large team of specialists there who also helped confirm my diagnosis and come up with a plan to work on some treatment options for my symptoms. They would call me in the evening and let me know what we were planning for the next day. And it reminded me of what we have at Billings Clinic from a perspective of multi-specialties working together. I left Mayo Clinic and had a number of treatment options to help with my symptoms, and now I'm working full-time. I'm back to living a full life, walking, and doing the things I would normally want to experience in life. I am so excited that Billings Clinic has a formal relationship with the Mayo Clinic Care Network. It's an amazing venture that will really be an advantage for a lot of people in the future.